Minister Stuart Roberts, thank you for joining us.
Pleasure.
Why are children with disabilities waiting up to 700 days for a diagnosis?
That's a question you should ask a state health minister, because the state health ministers are responsible for their state hospitals. So putting that aside, that is a state health issue, remember under Section 25 of the NDIS Act, if you have a child under the age of 6 that you believe has development delay, you can take them straight into an early childhood, early intervention partner. You don't need a diagnosis to seek access into the NDIS.
So you say you don't need a diagnosis to seek access to the NDIS, but the parents that we've spoken to, paediatricians, even the AMA, say that you do need a diagnosis sometimes to access the NDIS. Why is there such a disconnect between what the government is saying and what parents and families are saying is happening on the ground?
Well, I'll tell you what the law says. So Section 24 of the Act says if you've got a permanent and significant disability, you'll need a diagnosis to access the NDIS. But Section 25 is specifically designed for early childhood, early intervention, so development delay. Under Section 25, if you've got a child from 0 to 6, they can gain access under the early childhood, early intervention pathway to get that early intervention. And of course, once they turn 7, that's when a diagnosis is necessary for them to continue into the scheme.
So that may be technically true, but the families we spoke to said they couldn't access any early intervention funding until they had that diagnosis. Now, these are children under the age of 7.
I encourage all families, get onto the NDIS website, call their early childhood, early intervention partners, 18 around the country, and if they've got any concerns, to take their child in and have that discussion with that early intervention partner, because that's what that stream is there for.
Well, you're encouraging them to have a discussion, but the AMA is encouraging you to have a discussion with the NDIA, saying that you're potentially out of touch with what's actually happening on the ground. Is that a possibility?
No. I'm pretty clear on how the NDIA runs. I run the organisation. It knows its responsibilities under the Act, and it knows it needs to get children in quickly, and it's doing that. The quarterly data came out yesterday, and it shows that access decisions for children into early intervention is 3 days.
We're not talking about access decisions here, though. We're talking strictly about a diagnosis. Why are families telling us that they're not able to access NDIS funding without that diagnosis?
Well, I'm telling you that's incorrect. You can access funding under the early childhood.
So the families are lying to us?
No, I'm simply saying that the pathway is available right now. Families need to go right now into their early childhood partner to get access for their children, and if they're having trouble with that, they should contact the NDIS, or they can contact their local MP or contact me, because the law is very clear, my agency is very clear, the pathways are very clear. We are absolutely committed to taking care of children in the early childhood pathway, and access right now. 6 months ago it was 43 days. Today it's 3 days from speaking to an early childhood partner to access into the NDIS.
Just to get back to the diagnosis, aside from the NDIS funding, if we accept the government's claim that you don't need a diagnosis,
if you believe the law, and the law is quite clear.
If I accept your version of events over the families I spoke to, a diagnosis is important for other reasons. It effectively explains the reason why a child has a developmental delay. Is it acceptable children are waiting up to 2 years to find out the reason behind that developmental delay?
Of course not, but that's a question you should ask a state health minister that runs it. Now, having said that, I've anticipated all this. We've started a second trial into functional assessments. That trial will finish in a matter of weeks, and all going well, and it seems to be going well, we'll go to market for a functional assessment partner, and from 1 July we'll start a functional assessment as the basis for access. And that's designed to make it a lot more quantifiable, a lot faster for people, and that way the issue is not questioning their disability, but looking at what function they have and what level of support they'll need to speed the whole system up. But I don't run state hospitals.
So it is a state issue, but the states say that the rollout of the NDIS has put increased pressure on the state-based diagnostic teams in public hospitals, and that they need extra Commonwealth funding. Is that something that you would potentially consider?
No, because it's wrong.
So they don't need more funding?
The NDIS is replacing state-based supports. So parents with children with development delay, the same numbers we have now are the same sort of numbers we had 2, 3, 4, 5, 6 years ago when states ran disability services. So all the NDIS is doing for permanent and significant disability is replacing what the states initially ran. So this is not a huge surge of people coming through. We've always had children with development delay, and the states have already dealt with it, or should have been dealing with it. So why is it now state hospital systems are saying there's a particular problem, especially when federal government for funding for public hospitals has increased by 66% over the last 6 years? So the states have always had this responsibility.
You're the federal minister responsible for the NDIS scheme. Aren't you concerned that children are waiting up to 2 years for a diagnosis, and wouldn't you want to see that rectified, and wouldn't you then potentially see if you could take money out of the NDIS to help them speed up that diagnosis process?
Well, under Section 25, I know you don't need a diagnosis to access the early
But as I
childhood
already
pathway.
explained, there are other elements. As I said, there are other reasons for a diagnosis, including working out the reason for developmental delay. It's important for other reasons as opposed to accessing the NDIS.
That is a state responsibility. And it's very clear we understand what's state and what's federal. Now, I know everyone wants the federal government to solve every single problem, but we can't. States have primary responsibility for healthcare at that state hospital level, and they are responsible for it.
Have the states raised this with you?
They have not.
Will you raise it with the states?
The state health ministers are very clear on their responsibilities. I'm clear on mine, and I'm also clear you don't need a diagnosis under Section 25 under the early childhood pathway. And I encourage parents, if they're having any issues, to contact the NDIS or indeed their local member of parliament, or contact my office.
So the federal government at this stage doesn't have any plans to ensure that kids wait longer for a diagnosis?
We don't have any plans to step in and solve the failings of state hospitals. No, we do not, because that's their responsibility.